offensive actions in Borno and Adamawa states, killing several Boko Haram and ISWAP fighters. According to Major General Bello, troops also apprehended 45 terrorist informants, collaborators, and logistics suppliers, and rescued one kidnapped victim. Bello said troops of Operation Fageyama in the northwest killed several terrorists across Sokoto, Zamfara, Niger, Katsina, Kebbi, and Kano states during the period. The Adamawa State Judiciary, in collaboration with the Public and Private Development Center, has discharged 57 inmates and granted bail to 29 others as part of an ongoing decongestion exercise across correctional centers in the state. The Chief Judge of Adamawa State Justice Hafsat Abdul Rahman announced the figures on Friday during a conclusion of the jail delivery exercise at the Jemeta Custodial Center in Yola. According to her, the committee also reviewed the sentences of 3 inmates and assessed the cases of 52 non-convicted inmates. She noted that the Public and Private Development Center paid fines for 4 inmates who had been convicted with an option of fine leading to their discharge. Justice Abdul Rahman advised the released inmates to conduct themselves responsibly and avoid returning to criminal activities. She explains that many of them had committed minor offenses and were not considered to require prolonged detention. The International Federation of Women Lawyers Nigeria has said the proposed reserve seats bill for women in Nigeria's legislature should not be misconstrued as a privilege but recognized as a corrective tool designed to address decades of enriched structural imbalance in political pre-representation. Speaking on Friday in Abuja at a press conference to mark the commencement of the 2025 FIDA Nigeria Abuja branch Law Week themed Advancing Women's Representation of their Reserved Seats and the Future of Nigeria's Legislature. FIDA Abuja branch chairperson Chioma Onyenucheya Uko noted that the theme was deliberately chosen. She stressed that Nigeria currently stands at a constitutional crossroad, with women still significantly underrepresented in politics despite their contributions across the country's social and economic spheres. She noted that democracy cannot thrive when half of the country's population remains excluded from leadership and decision-making processes. Onyenucheya Uko also encouraged Nigerian women to participate actively in politics, whether through reserved seats or open contests, emphasizing that the national decision-making table remains incomplete without them. Moving on, the House of Representatives Committee on University Education has called for an immediate overhaul of infrastructure and facilities at the Federal University of Petroleum Resources, Efuru, Delta State, warning that the nation cannot afford to neglect a specialized institution critical to the development of manpower for Nigeria's oil and gas sector. Chairman of the committee, Abubakar Fulata, made the call on Friday during an inspection tour of federal universities in the South-South region. He noted that Federal University of Petroleum Resources, by virtue of its mandate, should rank among the best equipped universities in the country, but like many federal institutions, continues to struggle with inadequate funding on outdated facilities. In Nigeria, insufficient support for research and innovation. For years, federal universities in Nigeria have battled chronic underfunding, leading to deteriorated infrastructure, overstretched classrooms, obsolete laboratories, and declined staff morale. Fulata stressed that the committee's assessment visit were not intended to witch hunt but to ensure accountability and draw national attention to glaring gaps in university funding and management. He urged the federal government, intervention agencies, and key players in the oil and gas industry to invest more robustly in specialized universities, especially in line with the provision of the Petroleum Industry Act. Legislative business has been paralyzed at the Bauchi State House of Assembly following a strike action by the Parliamentary Staff Association of Nigeria, PASAN. The workers donned tools to demand financial autonomy for the state legislature. The chairman of the association in the state, Adamu Yusuf, said these on Friday in Bauchi, noting that their members joined the strike in compliance with directives of the national leadership of the association. He said the action aims to compel federal government to implement Financial Autonomy Act, a critical step towards strengthening parliamentary independence and deepening democratic governance. According to Yusuf, the industrial action is a collective stand by the state chapter of the association to intensify pressure for the long-awaited reform. In recent years, PASAN has organized several nationwide or multi-state strikes that shut down state assemblies, with its action often tied to enforcing constitutional provisions on legislative autonomy and improving the welfare of parliamentary workers. The majority leader of the Ondo State House of Assembly, Olatunji Oshati, has spelled a report that the House has been engulfed in crisis as a result of a plan to change the leadership of the Assembly. Social media reports stated that some members of the House have passed a vote of no confidence in the Speaker of the Assembly, Olamide Oladiji, following an allegation of gross misconduct. The report added that the aggrieved members had commenced an arrangement to impeach the Speaker. However, the majority leader in a statement issued on Friday said the House was still intact and there was no crisis in the Assembly. He added that there is no impeachment move against the Speaker, stressing that there is never a topic of discussion at either the plenary seating or any of the House of Parliamentary meetings. Oladiji also advised journalists to always balance their stories before dissemination in order not to cause unnecessary tension as the ethics of their profession dictate. In other news, President Bola Tinubu has renewed the appointment of retired Brigadier General Buba Marwa as chairman of the National Drug Law Enforcement Agency (NDLEA) for another 5-year term, extending his leadership until 2031. Marwa, who hails from Adamawa State, was first appointed NDLEA chairman in January 2021 by former President Muhammadu Buhari. Before that, he served as chairman of the Presidential Advisory Committee for the Elimination of Drug Abuse from 2018 to December 2020. His reappointment was contained in a statement by the Special Advisor to the President on Information and Strategy, Bayo Onanuga, on Friday. Tinubu described Marwa's reappointment as a vote of confidence in his agency's efforts in tackling the menace of drug trafficking. During his tenure as NDLEA, Marwa oversaw significant successes, including the arrest of 73,000 drug mules and barons and the seizure of over 15 million kilograms of various hard drugs. Patients and relatives are reacting to the ongoing strike action by the National Association of Resident Doctors, NARD. NARD had on November 1, 2025, gone on an indefinite strike to protest unpaid salaries and allowances, poor working conditions, among others. Meanwhile, as some say, healthcare services have not been delayed. Others say otherwise. Lydia Adigbaju completes the story.
It is day 13 of resident doctors' strike as the Nigerian Association of Resident Doctors, NARD, proceeded on an indefinite strike over unmet demands, which includes improved welfare, better working conditions, and the implementation of agreements previously reached with the government. Resident doctors refer to doctors in training, which comprises house officers, resident doctor junior registrars, senior registrars, amongst others. Speaking on some of the travails facing the doctors, Dr. Philip Ajibade, the president of the Association of Resident Doctors Union Chapter, lamented excessive work hours, which he said was endangering the health of doctors. Citing examples of doctors who have died on the job, Dr. Ajibade advocated an end to a 48-hour call for doctors, calling it a killer practice.
Because what people don't know is that when you are hypertensive, you can walk now and just fall down, collapse. That's probably cardiovascular stroke. You understand? You have stroke, you can have heart disease, you can have a lot of conditions underway in your body. So these are doctors, and this comes from unregulated work hours and excessive stress. So let us stop this idea of doing this 72-hour call. There's not even about it. 72-hour call is a killer. 48 hours is a killer. We need to stop it totally and off the duty.
But how is this strike impacting patient care in hospitals in Osun State? In a visit to Union Osun Teaching Hospital, Mrs. Cynthia Adeleye, who came for her optical checkup, speaking to Western Spring Television, said the process has been smooth in the 3 times she has come. Similarly, Mrs. Adeyeye, a patient's relative, said though they came in around midnight, they are being properly attended to. The story is the same for Alhaja Mistura Raji and Mr. Kabiru Adebayo, who brought their children to the hospital.
Around doctor attended to her. What then take care dada? That's what I said. Be one feedback on so people ya want that shele come attend to her. Toro rula debi by, but at the debi loru. One attend this, so I didn't improvements.
Arenya da wa lohun, wọ́n try gan, wọ́n gbìyànjú, wọ́n dá sẹ́lẹ̀. Bí wọ́n tẹ̀ ni wọ́n dá sẹ́lẹ̀, wọ́n ṣiṣẹ́, a rí doctor, ara wọn nurses, gbogbo wọn ni wọ́n attend sí wa dáadáa, wọ́n sì tọ́jú wa. Ọmọ mi wá bímọ ni, ó sì bí láyọ̀.
Báwa náà ṣe gbọ́ láàárọ̀ ni bọ̀ wọ́n ti dá lóhùn láàárọ̀ yìí. Wọ́n dá lóhùn àti wọ́n ti attend sí wa kan lọ ṣe test náà là ń dúró de result test. Mo ṣe pé normally pé àwọn èèyàn tán ti expect kí wọ́n wọṣẹ́ èrò máa ra pọ̀ ńlẹ̀lẹ̀ tó máa jáde wá fún treatment. So wọ́n dẹ̀ ti ní procedure tí wọ́n ṣe kalẹ̀ lẹ́ka wọn tẹ̀lé. However,
the story was not the same for Alhaji Ahmed Adeyeye, who lamented the delay in healthcare delivery owing to doctors downing tools.
Àwọn bí àwọn student la kan rí tí àwọn lọ tí àwọn bọ̀ cause àwọn rí doctor gangan àrí wọn cause ọmọ ẹ̀ ó yẹ kan ti ṣiṣẹ́ lórí ẹ̀ ká ti rí proof. But àwọn náà àwọn student yẹn ẹlòmíì gan ò mọṣẹ́ wọn kàn fi hàn kọ́ṣẹ́ tí wọ́n fi hàn ṣe kínní ni because abẹ́ tí àwọn ọmọ yẹn tó pé ojú mi kéré so wọ́n fi wọ́n ṣe training ni.
Meanwhile, the President, Association Resident Doctors Union Chapter, decried the immense but avoidable stress that patients' relatives go through, saying this would not be the case if teaching hospitals were well funded. He cited this as well as poor working condition as some of the reasons for brain drain in Nigeria's health sector. The resident doctors claim the federal government owes 38 billion naira in salaries excluding allowances and that their salaries have not been reviewed in 16 years. It is, however, hoped that the federal government would call for a dialogue soon with stakeholders in the health sector to resolve the matter so patient care as well as workers' well-being would be prioritized. Lydia Adegbaju, Western Spring Television News.
Thank you, Lydia. Moving on, the Joint Health Sector Unions, JOHESU, and the Assembly of Healthcare Professional Associations have declared an indefinite nationwide strike effective Saturday, November 15, 2025. The union cited the federal government's persistent failure to implement and adjust a consolidated health salary structure, coerce and resolve long-standing welfare and systemic issues affecting health workers as the reason for the strike. The decision was announced in a statement signed by the national chairman of JOHESU, Comrade Kabiru Ado Minjibur. The shutdown of JOHESU affiliated unions comes as a time The Nigerian Association of Resident Doctors (NARDs) already on an indefinite strike over unpaid hazard allowance arrears, poor working conditions, and failure to implement agreed welfare reforms. The overlapping strikes by both doctors and other health professionals are expected to cripple services in federal teaching hospitals, specialist centers, and many state-owned hospitals. Joe Hesu represents several key unions, including the Medical and Health Workers Union of Nigeria, the Nigerian Union of Allied Health Professionals, the Senior Staff Association of Universities, Teaching Hospitals, Research Institutes, and Associated Institutions, and the Non-Academic Staff Union of Educational and Associated Institutions. Still to come. African Democratic Congress takes victory lap after federal government suspends its controversial 15% import duty on petrol and diesel, insisting that the suspension confirmed its warning that the levy would worsen the country's economic pains. We'll bring you more on this when we return.